Hey, Javante, my name is Nurse Brown. I'm here to take care of you today. Would it be okay if I come in?
Yes.
Okay, I'm gonna go over to the sink and wash my hands and get apply my gloves. Okay.
Okay.
Alrighty. After washing my hands and applying my gloves, I'm gonna go ahead and come into your room, and I'm gonna explain to you what I'm here for today. Can you tell me your name and date of birth, please?
Javante Brown, April 10, 2011.
Okay. Will it be okay if I check your armband?
Yes.
Before I do that, I'm gonna go ahead and pull the curtain and provide some privacy, okay?
Okay.
Okay, can you tell me your name again?
Javante Brown, April 10, 2011.
Great, you are the person I'm here to work with today. So the doctor has ordered you a head and neck assessment to be performed because you had a fall at football practice. So what I'm gonna do, I'm gonna explain every step that I do, okay?
Okay.
Alrighty, so what I'm doing now, I'm looking at Javante and I'm making sure that there's no drooping of the facial, no signs of a stroke, and he seems like everything is intact. So the first thing I'm going to check on him, I'm going to check cranial nerve number 1, which is the olfactory nerve. Javante, can I have you close your eyes? And I'm going to put something up to your nose. Can you tell me what it smells like?
Pepper.
Don't open your eyes. Close your eyes. Okay.
Pepper.
Alrighty, and you can go ahead and open them. I just checked cranial nerve number 1, and that nerve is intact. I'm gonna go ahead and record it, and I'm gonna go ahead and check cranial nerve number 2. So Javante, I'm gonna have you to can you open it? I'm actually gonna go ahead and check cranial nerve number 2, cranial nerve, which is his vision, but there are 2 tests that I'm going to perform. So what I'm going to do, I'm going to, can you stand up for me? Okay, turn, can you turn this way? All right, put your feet together. And I'm going to have you cover your right eye. Can you cover your right eye? Okay, and I'm going to cover my right eye. And what I'm going to do, I'm going to step back. Turn a little this way. Good. Wait, just like that. Good. And I'm gonna look at me, and I'm gonna put a number up. Can you tell me what number you see me put up? Keep your eyes up, okay? All righty.
2.
Okay, stay up here.
1.
Okay. Now, can you cover your left eye?
Yeah.
Look at me.
4. 5.
No? Okay.
2.
Okay. Good. So I just checked his optic, and that was good. I'm gonna go ahead and check. You can go ahead and have a seat. I'm gonna go ahead and check cranial nerve number 4, 6, and I'm looking for Perla, and let me go ahead and record. My findings are intact, and I'm gonna go ahead and check cranial nerve number 3. So what I'm gonna do with this is I'm gonna one more thing, Javante, can you stand here? I'm sorry. Cover your right eye. Do you wear any contacts or glasses or anything? Do you have them with you today? Okay. So what I'm gonna have you do, can you cover your right eye? Cover your right eye. And I'm gonna read the lowest line you can read for me. The lowest line you can see.
D, E, F, P, O, T, E, C.
Good. Now I'm gonna have you cover your left eye, and the lowest line you can see. Read that to me.
D, E, F, P, O, T, E, C.
Good. So you can go ahead and have a seat. Good job. So Javante has read line number 7, which tells me out of 25 feet out of 20 feet, 25 people can read this line. So his eyesight is intact. That cranial nerve is working very well. So the next test that I'm gonna perform, you okay? Okay, I'm gonna dim the light. And can you just look straight ahead for me?
Yes.
Okay, and I'm just, open your eyes very, very wide. Good. And what I'm doing here, I'm looking at his pupils to make sure that they constrict and they're doing exactly that. And I'm coming from the side. Good job. That cranial nerve is intact. So I'm going to record that finding. The next thing I'm going to do, I'm going to have Javante follow me. I'm going to go straight to your nose, okay?
Okay.
Keep your eyes on the pen. Good. Okay. The next thing I'm going to do, I'm going to take it this way. Good. Good. All right. Okay. Now I'm going to... Good job. And can you frown for me? Good. His eyebrows is doing exactly. Can you blink, open and close your eyes? Like closing and holding. Good. Good job. All right. So that cranial nerve 3, 4, and 6 is intact. I just look for Perla. Can I pull your highlight? I'm looking for conjunctivitis. And his sclera is white, reddish pink a little, but it's within normal range where it's supposed to be. So the next thing I'm going to do, I'm going to check cranial nerve number 7, which is his face, let me see. Okay, I'm going to check cranial nerve number 7, which is his facial. And I'm going to have you, can you put your teeth together? Well, this is for feel here. I want to feel there. And cranial nerve number 7 is doing exactly where it should sit. Checking his maxilla bone. Can you open and close your mouth? Good. That's intact. Next, I'm going to go ahead and get my optoscope light, and I'm going to check cranial nerve number 8, which is the auditory nerve. And what I'm doing here is looking at Javante's ear with my light. Use this pen light. And I'm making sure that is no destruction of the ear. His right ear should be at 5 o'clock. His left should be sitting at 7. And that is intact. So I'm going to record my findings with that. The next nerve I'm going to check is cranial nerve. And I'm going to take this is a stick here. This is a spoon, actually. And I'm going to have Javante open his mouth. Can you say ah? And this is cranial nerve number 9. Actually, I'm going to go ahead and do cranial nerve number 9, 10, and 12 because 10 is going to actually tell me he's talking. So that's the movement of the tongue, and it's showing me that nerve is working. So can you open? Number 9, cranial nerve number 9 is his glossopharyngeal, and this is his gag reflex. So what I'm gonna do, I'm gonna have him open his mouth, open wide, stick out your tongue. I'm gonna go back deep. You gotta open wide. He jerked, so that let me know that his gag reflex is working. Can you lick out your tongue? Good. Can you move your tongue side to side? Good. Alrighty. So I checked those nerves, and those nerves are intact. The next thing I'm going to do is check cranial nerve number 11, which is his spinal accessory muscle. So Javante, what I'm gonna have you do, can you turn your head from side to side? Good. That nerve is intact. Can you move your shoulders up and down? Good. So cranial nerve number 11, which is the spinal accessory muscles, those are those are working and they're intact. Cranial nerve number 5 was his sense of feel. Did you feel me rub across your face? Do you feel? Yes? All right. I'm going to go ahead and check your temple. Any pain?
No.
No? That feel good? Or it hurt? Okay. So I checked Javante's cranial nerves from 1 to 12, and I'm gonna go ahead and record all my findings in my notes. The next step I'm gonna go ahead and don my gloves and dispose of them properly. Then I'm gonna practice washing my hands again with safe hygiene. I'm gonna gather my things, and then I'm gonna go report my findings to the personnel.